warm and sunny spring day.
That's right. All that sunshine might be calling your name, but COVID restrictions are still curtailing social activities. We know people just want to get back to normal, us included, but the Oregon Health Authority says now is not the time to let your guard down.
Fox 12's Kendra Kent has more on the advice from local health leaders and whether people are still willing to heed it. She joins us now, all new at 6. Kendra?
Yeah, that's right, Pete, and people really are loving the sunshine, myself included, but the Oregon Health Authority really, at this point, isn't changing too much of its travel guidelines. Yes, you can get together with friends or family members if you are vaccinated and they are also vaccinated or low risk, kind of at somebody's home situation with not too many people. But for the most part, the main point that they want to get across right now is people really should still try to stay home. Just try to stay home as much as possible. So don't travel really unless it's absolutely necessary. That's what folks at OHA are telling us.
Sunshine, warm weather, and a growing number of cases of COVID fatigue.
Gosh, I got to get out and see friends.
I don't think I would get on a plane, but I would absolutely road trip somewhere.
I'm going to travel.
Itching to get out there and ready for normal life. So when will health officials give the okay to mingle in larger groups, see people outside your family, and travel? We'll get to the recommendations, but first, let's look at where we're at in terms of numbers. In a new report released Wednesday, the Oregon Health Authority says the COVID-19 infection rate is up for the third week in a row, and hospitalizations are also up, but not as significantly. The death toll from the virus is also up. 47 people died within the last week, the highest amount of COVID-related deaths in 5 weeks. Another trend, the demographic of those getting COVID keeps getting younger.
And I think people are just going out there and interacting a whole lot more. They're interacting with people outside of their bubbles, so to speak.
But also consider this. OHA says about 28% of adults are now fully vaccinated, and about 44% of Oregonians 18 and older have received their first doses of the 2 series. We also know that those most at risk from complications with COVID-19, the elderly, have largely had the opportunity to get fully vaccinated, as have first responders and healthcare workers. Plus, more and more people are getting vaccinated every day. So we asked the questions on many people's minds. Why is the Oregon Health Authority asking people to avoid travel, then quarantine upon returning home if you do travel, even if you are vaccinated?
The more disease there is out there, the higher the chances that there will be more variants. And the higher the chances that more and more people will get sick from this.
And public health officials also warned just because you're younger or healthy, you could still get really sick and have trouble recovering.
It is still a major concern if we have a lot of young people who end up with this with the long haul syndrome.
And hospitals like OHSU agree it's still not time to let down your guard.
We have seen a steady uptick of patients. We currently have 11 patients with COVID-19.
OHSU believes it's only at the very beginning of another hospital surge. How severely beds fill up, only time will tell.
The most important take home from this is vaccination is really a critical piece.
With all Oregonians soon becoming eligible to get the vaccine, health experts say how the next month plays out will be critical.
If we want to go back to a normal summer and a normal fall, we have to clamp down now.
And health officials say that herd immunity will be so important. They say that's when, perhaps 75 to 85% of Oregonians have been vaccinated. They do say that they are hopeful that we can get there or get close to that by as early as mid-June. Reporting live tonight in Northwest Portland, Kendra Kent, Fox 12 Oregon.